Everyone. My name is Barney Morris, and I would like to welcome you to Session 4 of the 21st Annual African American Prostate Cancer Disparity Summit, reducing the disparity with new prostate cancer treatments and clinical trials. Now, for many of you already are aware of FIN, but for those that aren't, FIN, or Prostate Health Education Network, was founded in 2003 by Thomas Farrington, and it provides education and awareness to African American men primarily about prostate cancer, early screenings and detection treatments, clinical trials, statistics, managing survivorship, and bone risk. Now, the primary mission of FIN is to eliminate the African American prostate cancer disparity and to increase the overall support and resources for this war on prostate cancer. Now, many like me often felt that prostate cancer was affected old men. Uh, and today's session will allow you to hear from some outstanding men across the age spectrum. And we can see that this disease doesn't just affect elderly men, a senior, which I am now, but it also affects younger men. Specifically, myself, in 2004, I was 41 years old. I was, thought I was very healthy. I was a senior federal agent. I was a major in the Air Force, living well in Tallahassee, Florida. And through a routine physical examination, my prostate specific antigen, a PSA, came back slightly elevated, which raised an alarm to my primary care physician, and she referred me to a urologist. And in turn, I was eventually diagnosed with prostate cancer at 41. Back in 2004, there was little to no information surrounding prostate cancer for men under the age of 50. And there was even less information for men Black and young. Uh, I just wish something like Finn had been around to help me navigate this journey. It was a difficult journey. Now today, you're gonna, like I said, you're gonna hear from some men. They can tell you about that. They can tell you, they be able to share stories about the specific journeys that they have had, and you will see that this cancer is an equal opportunity employer. It does not discriminate. Next, I would like to bring up a young lady, Miss Tamika Miller. Tamika has been on the ground fighting with us, side by side with us on this disease, and making sure that as much information and resources are available to those out there across this great country to help reduce this disparity and overall help reduce the number of young men, young, old, and what, if you will, from dying from this disease. So with that, I would like to bring on Ms. Tamika Miller. Tamika.
Thank you, Barney, for that wonderful introduction. I will say I have known Barney, he's right, since FEN began. And it's been about 20 years now. And for anyone who knows Barney, he was always on the move. We get an email as a staff each week, and it says the subject line, Barney on the move. And I have to tell you, I look forward to that email every week from him and so many other ambassadors that are doing fantastic things on the ground on behalf of eliminating the African American prostate cancer disparity. We're so grateful to him also for his dedication to our country as a former Air Force officer and his dedication to our mission and just always being willing to come when called. And I will tell you, everyone on this panel today, not one person hesitated when I said, will you join us in this discussion? And you don't always get that. So we're so pleased to be here. I want to welcome you all to our final of 4 sessions of the 21st Annual African American Prostate Cancer Disparity Summit. And I don't know if you tuned in for the prior 3 sessions, but man, those are some tough acts to follow. I want to thank everyone who has presented this month, the Prostate Cancer Awareness Month, for showing up and for being here. Thank you for taking the time to be here for yourselves and the men in your lives who you love. We could not do this work without you, and we are so grateful. We also could not do what we do without the support of our incredible president and founder, Tom Farrington, our wonderful FEN team who works tirelessly day and night and our sponsors. And I want to give our huge sponsors a thank you for their support and encourage you during this webcast, or if you have some downtime today, to visit their online booths. You can do that by clicking on their sponsor logos in the lobby of this webcast or clicking on the word exhibitor. So today we're going to be discussing the panel topic, prostate cancer patient journeys, understanding needs and empowering every generation of survivors. Because as you just heard Barney say, prostate cancer impacts young men too. Then I'll share an update on our collaboration with Dana-Farber Cancer Institute on what we've learned and some takeaways from our Managing Survivorship Support Group meetings. Our president and founder, Tom Farrington, will make some very well-deserved award presentations to those who are working in the field for us. And we will show you a very heartwarming and moving tribute to a Fen legend and ambassador, the late Dwayne Charleston. We'll conclude with your survey feedback, any feedback that you want to offer us or recommendations, and closing remarks from the summit. So with that, let's just jump right in. Last week, if you heard or were on, Dr. Crawford told us that the prostate cancer incidence rate is 3 times as high for Black men between the ages of 40 to 44, and the death rate is 5 times as high within those age groups. So men are getting prostate cancer at an earlier age, and they're getting it more aggressively. And yet, prostate cancer is often characterized as an old man's disease. So today I thought what I would do is begin our discussion with a video of a younger man who has been pivotal to Fen and our work. He is a Survivor Network member in Boston, and he has a story to tell about being diagnosed as a young survivor. And then I'll bring our panel on after that. So let's go ahead and hear Rasan's story.
5. The unfortunate part of that is I was symptomatic probably for 4 years prior to diagnosis. And so I guess I want to start my message by saying, go to the doctor. When you feel something abnormal, or question everything, and you must be your own advocate. And so the symptoms came when I was getting like stomach pain, hip pain. It wasn't so bad, but it was present. Um, it developed over time, and I thought it was a digestive issue.
Okay.
So I went to my primary care right around 38, 39 years old. I started telling them what I was feeling and that things were a little off, and that I wanted to get some testing done, possibly a colonoscopy. He told me I was too young. They didn't start doing any colonoscopies until after 40, usually 45. And so as time went on, these symptoms developed. It developed into like lower back pain, a lot of hip pain, and I was active in the gym. And I guess the first thing I really noticed was my recovery time was getting longer and longer. I had difficulty recovering from regular exercises. And so by the time I was about 44, 45 years old, I was at work one day. I was not feeling well. I had gone to the gym that morning, and I just I wasn't recovering well. My legs didn't feel like they were under me, and that led to weakness and me almost passing out on the elevator. A friend of mine, as the doors opened, a friend of mine, a coworker, very good friend, Ted, he actually saved my life. He saw that I was not feeling well and that I had lost color in my face. He immediately made me sit down and get some water, and then he stood there while I called my doctor, and he escorted me to my car, and he said, "Can you make it home?" And I said, "Yeah, I'm fine." I drove home. Next day, I went to my primary care doctor, and I told him the pain I was having in my abdomen. He did like a cursory check, and he told me I had appendicitis, and
Mhm.
that I needed to go to the ER to get that looked at, and surgery possibly. The ER was less than probably 2 miles away. I drove to the ER. I got testing, MRI, CT, and when the results came back, I remember looking at the doctor's face, and their face kind of told everything. They didn't tell me the results, but they told me that the test was inconclusive and they had to run another one. And so they ran another one, and then pretty much I ended up in the 7th floor cancer ward with stage 4 metastatic prostate cancer.
Wow. 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 First, I want to thank you for sharing that story. That's not easy to tell. And we're so grateful that you've chosen to speak to other men and our groups about this. I want to back up even. You started feeling symptoms in your 30s, you said?
I think I was probably closer to 37 or 38 when I first started feeling different. I don't,
Right.
it was hard to explain, but I've worked out 6 days a week.
Mhm.
I I was a martial artist, so I was extremely active. I was in a men's basketball league.
Okay.
And so you kind of pay attention to like injuries and how your body responds to different stimuli.
Mhm.
And I just noticed my body was not responding like it used to. My
Mhm.
energy level was extremely low, and
So,
I just couldn't recover from like walking up the stairs. It would take 10 to 15 minutes to recover from walking up 3 flights of stairs.
so you were in pretty tip-top shape. You were active, you played basketball, you did martial arts, and you couldn't even walk up a flight.
I was a personal trainer as well. At the
Wow.
time I got diagnosed, I had I had launched my own training company, and I was doing coaching. I was concentrating on youth athletics, and I was coaching basketball and training a lot of young athletes. And so,
And
yeah,
okay. And so the doctor, when you asked for the colonoscopy and you knew something was wrong, and he said, no, you need to be 45 or we won't do it. I mean, did you continue to go to that same doctor?
I I did for about another year, and I asked him again, and his response was, "Oh, you're in great shape. Like for your age, you look great. There's no way anything's wrong with you." And then he asked about my diet. I've been a pescatarian for over 27 years, I believe.
Mhm.
And so he said, it's not your diet, it's not your digestive system. You're fine. Maybe you pulled a muscle,
If he didn't run one test on you?
not one.
Wow. Okay, so I want to ask you now, just starting from there, what advice do you have for men like you who go to the doctor, you know your body, you know something's wrong,
Listen to your body. Definitely. Like I know sometimes men are not the best advocates for their self.
right?
As far as getting regular and routine checkups, being forthcoming with information, sometimes some things are tough to talk about. And I don't think a lot of men have found a comfort zone with their doctor to ask questions, and to demand answers.
Mhm.
They may not have the answers on the spot, but be persistent and, demand testing, demand attention.
So that was Rasam's story. It never gets easier hearing a story. He is so articulate and so smart and did all the right things and went to the doctor. It obviously just wasn't enough. And I wanted to have him, he wanted to be here so much that he said, I'll record a video because anytime he gets an opportunity to tell this story, he wants to teach that we should demand doctors listen to our body and to begin PSA screen testing and just make sure that the message gets out there. So he couldn't join us today because he had a medical appointment, but he's doing well. He's a 7-year survivor, and we continue to pray for him. And with that, I want to introduce my esteemed panel today. I am so grateful to these gentlemen for making the time to be here. I would like to bring on Mr. Lou Fambles, a FEN ambassador from the state of Texas. Also, Mr. Tony Knox, prostate cancer survivor, former 40th Grand Basilius Omega Psi Phi fraternity from Charlotte, North Carolina, and our newest FEN ambassador. We're so excited to have him aboard, as well as Mr. Johnny Richardson. Mr. Richardson is also a prostate cancer survivor and FEN network member, also resides in the Charlotte, North Carolina area. And lastly, Mr. Michael Muffy, we call him Muffy Collins, president Run from Prostate Cancer, who is empowering young men in the city of Chicago to take charge of their prostate health. Gentlemen, thank you all for being here. You can come off mute.
Thank you.
Thank you for allowing us.
Absolutely. All right, let's jump right in. Lou, let's start with you.
Thank you.
Tell us at what age you were diagnosed and just give us some background into your personal story and your family history.
I was diagnosed with prostate cancer at 61 years old in February of 2019. My brother had prostate cancer. He retired as a pilot with Alaska Airlines. 3 of my mother's brothers had prostate cancer, and my father's only living brother had prostate cancer. 4 of my first cousins have had prostate cancer. 1 died from prostate cancer. So it runs in the family. So when I got it, and it wasn't a question of if I would get it, it was when I got it, I had people I could talk to and turn to ask questions. My brother and my oldest uncle had radiation only. They didn't have the surgery. One of my uncles and his son had the radioactive pellets or seeds placed inside the prostate. And then my youngest uncle had the traditional surgery where they made the cut. And then later he had radiation treatment. So I had I had a robotic surgery for mine, immediately started hormone therapy. And then a year later, I did the radiation treatment. So I can say as of 2 weeks ago, I've completed all of my therapies and I am cancer-free. So I am thankful for that. But I had an enlarged prostate since I was about 35 years old. So when they removed my prostate, it should have weighed about 33 grams, and it actually weighed 168 grams. Yeah, I guess I'm saying it right, grams. But it was 5 times the size it should have been. And they also removed some lymph nodes from that area, 8 lymph nodes from that area, and the seminal vessels. And 3 of those 8 lymph nodes that they removed had prostate cancer in them. So that's why I had to do the radiation. Unfortunately, I didn't know anything about the prostate until mine was enlarged. I just wish there were a way that we could learn about the prostate and its importance in our body a lot earlier, just like we learn about diabetes and obesity and heart disease and lung disease and all of those things from the media blitzes that the American Cancer Society and others put on to warn us about the health issues. But we don't hear about our prostate until we have a problem with our prostate. So I try my best to talk to men everywhere about early detection, but I wish we could start earlier, 5th or 6th grade with our young men to teach them about the prostate and prostate health so that they know something about it before they have a problem with it.
Right, right. Thank you for your story. It's an incredible story, and congratulations on being cancer-free. We're so blessed to have you as an ambassador and as part of our organization.
Thank you.
Next, I'm going to move to Mr. Tony Knox. Tony, tell us a little bit about your journey with prostate cancer and what age were you diagnosed and what's been going on with you since you've been diagnosed. I know you've been very active teaching about this.
Well, thank you, Tamika. And I was fortunate enough to have someone share some information with me when I was grand boss of the fraternity. I had a young man by the name of Michael Jackson who had prostate cancer as well as colon cancer, and he wanted to share. And so I actually listened to him, and after hearing him speak, I appointed him to chair a committee on prostate cancer. And after hearing him, I was 59 years old at the time. I went to the doctor and took the test, PSA test, and the doctor encouraged me then to go and see a urologist. I went and, of course, had tests, and after biopsy, he sat me down and he told me that I was positive. I did have prostate cancer. Well, he started out, he was telling me it was a slow growing cancer. We wouldn't have to take or do anything for 4 or 5 years. And I sort of smiled. And he said, "Do I really have to tell you how serious this is?" And I said, "No, but you told me to relieve myself of stress. And I'm the grand boss of Omega Psi Phi fraternity." And he stopped and he says, "We're going to start treatment right now." And so at that point, we put together a plan and we started talking about the different options. And at that point, we decided that we would go with the 24 hits of radiation. And then I had the seeds implanted in me. And I was fortunate enough to have Michael and the other brothers that I could share with. And my wife was most important. She went with me back and forth to the doctors, and she has no problem in asking questions. And there were questions maybe that she felt I should have answered. If I didn't ask those questions, she was going to answer them. And so she would ask questions, we get the information, and we work through the plan. And with that, I felt like I was really fortunate to have those surrounding me that supported me, my family and my friends. And I wanted to get the word out to the rest of the fraternity that this was important, that this was not just an old man's disease, and that this could come as early as 40, or maybe as we heard today, even earlier. So every opportunity I've had to share on it, I've shared. And Johnny Richardson, who is another panelist, actually shared with me about Finn. And of course I've sat in and now, whatever information I can get, I try and pass on, because a lot of us, our dads hadn't gone to the doctors. So we really had no idea who had it in the family, or even that it could pass through the bloodline. But now when those opportunities come, I'm happy to present, and hopefully someone will be saved by what we're sharing.
Thank you, Tony. And we appreciate your story. And that just brings us so nicely into Mr. Johnny Richardson. Mr. Richardson, it's great to have you here. And I wanted you here because we were in person, and I said, you told me at what age you were diagnosed. And I heard a little bit about your story at the Charlotte rally, but I really wanted you to tell your story here today and the importance of early detection screening. Mr. Richardson, are you there, or did you freeze? Okay. Well, we'll go back to him. I'm going to have Mr. Collins come on. Now, Muffy, you're not a prostate cancer survivor, but you have a personal story, and you have an organization that you've started called Run from Prostate Cancer. And I just want you to tell the story of why you chose to found your organization.
Yeah, absolutely. Well, thanks to Finn for having me here. I really appreciate it. And I appreciate everyone's stories. This is very helpful, so I can give information out, to my peers as well. But my story was a bit different. I started the foundation. I was about 28 years old. And this was based on how many men in my immediate family, best friends, uncles, childhood friends, their fathers, grandfathers, with prostate cancer, prostate health issues. I got a bit nervous about that. I wanted to figure out ways to maybe get information out, get some education, because it was a fear. First thing was like, I'm getting older. Will I be exposed to this? Will me and my peers will be affected by this? Like, what can I do to spread the message? Because you always hear about breast cancer, lung cancer, heart disease, diabetes, like you said before, but nothing pertaining to prostate cancer at all. And we got the NFL, Major League Baseball, NBA,
Yeah.
and it's talking about these sports are predominantly black, but the information is not there. You see breast cancer, NFL, every October. So I said, I got to do something about this. I don't know. I played college basketball in Austin, Texas at Houston Tillotson. So I was able to contact my coach. And he said, hey, I got, two peers that have been affected by prostate cancer. We got your back, whatever you need from our generation. So I just started doing some research with University of Chicago, Northwestern University. I created a men's tournament to get men screened. So you gotta meet the guys, halfway.
Where they are, right?
I gotta find ways.
Right.
We started a walk. This actually, I got the medal right here. This is our ninth annual walk this year. That and we do activations throughout the year. It's like panel discussions, seminars, screenings. We try to do at least 3 screenings a quarter just to get men active. We've incorporated youth arts so parents can't have an excuse on why they can't be there to be screened for that. It take 10 minutes. You signing up, you getting your blood drawn, but just the active. And this year at our event that we had over 100 men were able to get screened. Um, Sadly to say, over 85% of the men have never been screened before. And it was a nice percentage that didn't even know what prostate was. We're talking about men that are in their 30s and young 40s. I'm 42 years old, so me having to acknowledge and I have to, spread the word and awareness around to my brothers. So that's my mission. I stand behind it. I have 2 sons. They know everything about it, and I drill it to them so they can, tell their peers as well.
Thank you, Muffy. I was so impressed when I met you at what you were doing at a very young age. So we appreciate you. I'm going to come back to you. Mr. Richardson, it looks like you're back. Can you tell
Yes,
us your story and at what age you were diagnosed?
yes. Can you hear me?
Yes.
Yes. Good evening, everyone. My story is a little unique. I was at the age of 46 when I was diagnosed, and during that time period, I did hear about prostate cancer. I had an uncle who had it, and 2 uncles. My dad did not have it, but I had 2 uncles. 2 of his brothers had prostate cancer, and both of them died of prostate cancer. Um, the year was 2008 when it happened. And basically, I had no symptoms at all. None. I was very physical, active. I was in Marine Corps for 6 years. I wrestled in high school and in college. I was very physically fit, but I usually take my yearly PSA examination. And this year it came back 4.7. And I had it retested 4.7 again. So I went to the VA, they retested it 4.7 again. So they scheduled to go to the urologist, and I had a biopsy scheduled. And out of 12 of my specimens, 8 of them came back cancerous as prostate cancer. And when you hear that word cancer, um, you take a swallow, you sit back, and what just happened at the age of 46 to me? I have cancer. So I'm a God gifted individual. And I took it to the Lord. And I said, I don't have anything that's going to take me out until he says so. So therefore, at that time in my life, the doctor told me I had 5 different options. You could keep it in since you had no options and you can wait on it or, and maybe it might, because they had seen nothing except my PSA and or the 21-day treatment, radiation, or even chemo, or remove it. I said remove it so I will not have to deal with it at the age when I get older. So I had the Da Vinci, the robotic surgery. Took a little bit longer than it usually take doing my surgery. Um, when I went through the robotic technology surgery, it was very small incisions and stuff like that. I bounced back. You have to deal with the bladder, the leakage, and you have to deal with your intimacy sexual life. Those are 2 things that I was very concerned about. And the bladder went away no more than 2 to 4 months. And completely I have no bladder leakage as of right now. And my sex life has changed, but it's bounced back tremendously. 95%, I'm strictly right back. But my blessing is I've been cancer free for 17 years. My PSA score has not changed since 2008, right after my surgery. I get checked twice a year, and it has not changed. Like I said earlier, when I got diagnosed and they said I have cancer, I took it to the Lord. And I said, the Lord will take me out if it needs to be. As of 17 years, I've been cancer free. I'm a big advocate of telling people, go get checked. I have two boys, two sons, two adult sons. As soon as they found out about it, they was young. They was in middle school and high school at that time. And now they're grown adults. They get checked once a year, ever since the age of 30. I make sure they go. And the key is behind it. If you don't ask when you go to your doctors to get checked and tell them to have your lab work check you for PSA, they will not do it if you are younger than 45. They just do a normal blood test. They will not do it. You must ask for it.
Mm-hmm.
And that's the biggest thing. Oh, well, I got checked. I'm good. Did you ask for it? They say, oh, I didn't know I had to ask for it. You must ask for that when you go to and get your lab work done. You must ask them, especially if you're under the age of 45. You must ask for that. And other than that, I mentioned earlier, I'm 65 years old. I've been diagnosed. I'm still physically fit as of right now. I do have other injuries based on my military career, but other than that, I have a spiritual song that I say to everybody. I'm a living testimony of prostate cancer. So therefore, live your life the best way that you can. Live your deal with your family. My wife was my biggest supporter for me. She was there all the time with me throughout all of it. And I must say, we just celebrated our 40th anniversary, and I had to say that. And God bless
Congratulations.
you, and God bless everyone. And thank you for being on this panel.
Yeah, thank you. I want to say to you, Mr. Richardson, that is actually a song that we have a Deacon Fuller, Ray Fuller, and he sings that song at some of our events, and he's closed our summit with it. And he sings, I am a living testimony. So, everything happens the way that it's supposed to be according to God's will. So I'm so happy to hear you say that. And I want to go back to I'm hearing so many themes, and I'm taking notes as you gentlemen are talking, but I'm hearing these themes of you were not educated, but you all had some sort of family history. And I'm also hearing this theme of doctors telling you like, oh, it's up to you, or you have 5 options. That must be so overwhelming. And just kind of putting it back in your hands. But you were strong enough and willing enough to say, no, let me go a step further and see what I need to do as far as treatments. And then I'm hearing a theme also of women, supporters, caregivers. So my next question for you all is, and I'll go back to you, Mr. Fambles, how have you gotten support? Who's been in your corner for you? Who helped you through your journey while you were going through this? And I know you have a son who's 28,
Yes.
and you're teaching him everything he needs to know. But who's been there with you the most? Your champion?
I've had family and friends. For years, I lived in Raleigh, North Carolina. So when I had my surgery, 2 of my friends from Raleigh came down and stayed a week with me in Dallas uh, during that surgery. When I was going through my radiation, which I had in Boston, 2 other friends came up to Boston and stayed a week with me. What I do want to say, Tamika, and we kind of all tapped around it just a little bit, but in a lot of families, our family secrets are killing us.
Yeah.
Some people don't even know that there's prostate cancer in their families because there was this secrecy about medical issues and they never told anybody. So when we went in, there was really no reason to think that there could be prostate cancer in our families. And I'm going to say, just listen to the young men on the call today, the young man who went to Houston-Tillotson University now. I went to University of Texas at Austin. But nobody, when we were playing basketball, talked about prostate cancer. There's a young man on here, Brother Knox, who's an Omega. I'm an Alpha. Nobody until, we have to take responsibility as Black fraternities, as Masons, as church leaders. We have to take responsibility to encourage all of our men to get early testing because our family secrets are killing us.
Mhm.
And my uncles and my brother and my cousins, they talked to me about it. These are your options. When I was diagnosed, they said it was slow moving, slow growing. So we're going to do this active surveillance. Well, I've never talked to anybody who said they were under active surveillance where they improved during active surveillance. So when Johnny said he told him just take it out, that was the right thing to do because later on it can come back. When I was in my radiation therapy, there were several men who had had radiation at other places, and they ended up at Dana-Farber to get more radiation. So yeah, we don't need to take a chance on it. We need to get it out, and we know it crosses every border. Martin Luther King's youngest son, Dexter, died of
Mhm.
prostate cancer. O.J. Simpson died of prostate cancer. So we don't want to take a chance with this. But my relatives, my friends were all just right there to help me and support me all the way through this.
I love that. And thank you for sharing that. Tony, you mentioned your wife and she's your biggest advocate and she went with you to your appointments. And so tell us a little bit about your experience as having your wife as caregiver and playing that role.
Well, yes, my wife has been my biggest supporter, and she has no problem with asking questions. She's always been one that she goes to every doctor's appointment with me. She'll ask the questions. I even one time to tell you, she told me once that she had to use the restroom. The doctor was supposed to be finished. I had gone out, and I got out, got to the car, and it hit me. No, she was asking questions. So I went back in there, and sure enough, she was taking them through it. But it was that kind of support, that kind of advocate that really helped me along. And my daughter's the same way. She'll ask questions. They're like, well, Dad, you're a tough guy. You're not going to ask questions. You're not going to tell us. But they will make sure that I let them know what's going on and that they're willing to ask the questions. And if I haven't, they'll encourage me. My son is more or less, he pays attention. He knows. He doesn't push me the way that they do. But if he thinks something's wrong, then he also will say, Dad, have you done this or have you done that? But I've been fortunate, my family and my friends. I've never had a problem sharing that I had it and encouraging others. So in every opportunity at fraternity meetings, I'll share. So brothers will come up and ask me, how am I doing? They know I got the seeds. They know that, they'll ask, the seed's still working. I said, well, every time I go through the airport, they're lighting up and my PSA is staying down. So we think they're still working. But having that family support and the friends means a lot. And I feel like we're obligated to encourage the younger people to get checked because in my family, I only knew of my great grandfather having it. Now, my dad never mentioned it, never said anything about it. My grandfather, who actually raised me, he didn't care much for going to the doctor. And if he went to the doctor, he wasn't going to share with us what the doctor said. So I didn't know of anyone except my great grandfather. And then to learn that it is in the bloodline, it's even more important that I have to share with my son and those younger to get that message out.
Thank you for sharing that because that brings me to my next question, which was going to be, it sounds like you hit upon, and I want to start back with Muffy because Tony, you just told me what you're telling your son. Lou, you talked about what you're telling your sons. Johnny, you talked about it as well. And the support of your wife. But we have just a couple minutes. I want to go back to Muffy for 1 second. Muffy, I want to ask you, you have spoken about ways that you're bringing people into the community together to talk about this and meeting men where they are. So what are you doing to get younger men, say in their 30s and 40s, to know more about this disease? Like what kinds of activities are you doing so that they know more and are more educated earlier than some of the stories that we're hearing?
Yeah, so every Wednesday, so we're based in the Woodlawn community on the south side. So we're near University of Chicago, walking distance. But it's so close, but it's like so far away, if that makes sense. So you can walk 3 miles or you can run 5 miles. Pick your poison. But we're gonna get you there if you want to run. And we noticed that more and more men have been getting more active that way. It starts the conversation. Of course, there's a lot of ladies that walk as well, and it's a draw. These walk clubs and running clubs are now becoming like this new dating thing across the country. There's no knock to it. People are talking again, so I appreciate it. It keeps our community safe too. But I think most important, like that was a way for us to gear towards what can we do to start that conversation and then just deliver our mission in that way. And we even had so many emails of guys that want to talk privately and say, hey, can we talk to a Dr. Murphy, who is our urologist? He's a black guy who can convey that message directly to them in their face, opposed to some of our white doctors that may beat around the bush and no, you're okay, you don't need to get screened. We hear that a lot. So this has been coming back to us. So our message is okay, if we're seeing the age getting younger and younger and younger, how do we deliver to basketball? How do we deliver to track and field, all the sports? We dominate in those factors. My son is in college now, he plays basketball at University of Louisiana Lafayette. And his coach called me about, hey, Michael talks to us about prostate cancer. Is it that serious? So now that's a conversation starting, with one coach, and it can be over to the next. So I think it's finding the ways, meeting our guys halfway, but most importantly, having a conversation, talking to them about that. I applaud each one of you on this panel for speaking about this because there are some guys that choose not to speak about it. And it's not fair to us if we're trying to evolve and elevate as black men in this country as it's attacking us at alarming rate. We have to find every way. We have a marathon cheer station for the Chicago Marathon coming up in a few weeks. And so men will see that. They'll be able to talk to our support group. Just little things that can just lead to big screening outcomes.
Okay. Those are all amazing things that you're doing. And what caught my attention was you said we are even teaching young kids how to color different color ribbons so that they know what they symbolize and they can go home and they can bring these home and tell their parents about them. I mean, and it's all part of education, which I love. I also want to go back to you, Mr. Richardson. You are part of Omega Psi-Phi as well, and you're a network member and you've brought others in. What advice do you have for younger men and those who may not be aware of prostate cancer, may not be aware that they have a family history? I mean, what do you tell younger men, mentees, nephews, cousins?
Well, basically, you got to look for your audience. And at this time, I am pursuing doing prostate health barbershop talk. And that is something that you need to bring in. You find all different levels of men in the barbershop, and sometimes their mothers or their girlfriends or wives. But prostate, and I've been talking to a couple of owners that has barbershops in the Charlotte area. But those are one avenue. But it's always in the church that I will always go to speak to young men. But also, anytime I get a chance, I speak about it. Anytime. And I have referred people to tell people because I have received phone calls. Someone told me to call you because I have prostate cancer. So I do know the word is getting out. I do know that what I'm saying is people are listening. And at the same time, we just got to be more proactive. But to get to the younger individuals that look like us, I feel we all have to choose our audience. And at this time, I'm looking more towards prostate health, barbershop talk, and podcasts, wherever the case may be. But I'll let them run it because that's what they like to do. but I will come with the conversation, and I will come with the platform, and that's what I will do as far as answering your question.
I love that. I love that. My husband goes to Shop Talk as well, and they pick a topic and they talk about something each week, which I think is a phenomenal way of meeting men where they are. So,
Right.
yeah, I love that. And Tony, I want to get back to you because you mentioned the fraternities. So, what types of things are you saying in Omega Sci-Fi? I know that you, when I met you, you said I'm willing to go anywhere and talk to anyone, and I took you up on that very quickly. So, tell me, what are you saying out there when you meet men? Younger men, what types of things are you telling them about this disease?
Well, actually, just yesterday, I talked to a young man who has been diagnosed, and he's trying to determine which procedure he's going to take. I shared with him my process and what I went through, and offered to, at any point, discuss it with him and tell him the reason I chose to have the seeds implanted and how it's going for me. And I've had brothers call me at different times because when at a meeting, we'll keep it above board and talk about high level, but offer to meet at any time, to offer to share offline if necessary. And we've encouraged them to have the committees where it's a regular discussion. Everyone has a health disparities committee or a health committee, but I think it should be specific on prostate cancer. And it may grow to other things, but don't do anything and leave prostate cancer out because it is serious, because of the fact it is impacting our young men. And the thing I try and encourage is don't wait. Go and get checked because early detection gives us so much more of a chance. Those that I know of that have had early detection, been blessed, they're able to share. But every morning at 6:30 a.m., I'm on the prayer call for the Mega Sapphire Fraternity. And unfortunately, we hear of some who didn't find out soon enough. And we've lost some brothers because they weren't aware. So I feel like we need to share this, and not just within our fraternity, the entire Divine Nine, especially the male fraternities, that we share, that we work together on this because we can make a difference. And the young men look for those who've been in particular things, who've shared the spotlight, who've been in something else. The fact that I was an athlete, a college athlete, and I've done different things, they may listen. And if they're willing to listen, then I feel like I need to be willing to share. And there are many of us who have been in that position. And for whatever reason, we kept it to ourselves. And my wife, at one point, before I really shared with the rest of the family, I kept it to myself. And she was like, well, don't be afraid to share. You especially need to let the family know. And I don't think it was until after I got the treatments that I shared with my sisters as well as my brother. I didn't want anybody to worry. But of course now I worry him to make sure that he's getting
I love that. I love that.
And I think that's what we're obligated to do.
I love that you said that. And there's that theme again of our wife and our champion or our spouse or a friend. We see a lot of men bringing other friends to our rallies and just getting the word out. I want to make sure if there are any questions from the audience, please put them in the chat or please ask them in the Q&A. I'm not sure if we have any yet, but I also just wanted to ask one more question of Lou. Lou, you and I talked a little bit about a curriculum, right? Like developing something. And I want to ask the same question for you. What type of curriculum, if we were to develop one, would you want to see out there for younger men who are going through this or maybe don't even know about prostate cancer yet? I mean, even as young as third grade.
Yeah. Well, I think, and Brother Collins here on the call, I just thought he had all the right ideas. We need to be where Black men are in order to educate them. Barbershops, basketball courts, football games, bars, churches. We need to be wherever Black men are. But by the time we learn about it, we already have a problem. So if we started with the third grade or the fifth grade, to just educate them on this walnut-sized gland in their body that can literally take them out. And if they just understand that glucose that is produced in the body when we break down sweets and carbohydrates feed cancer. So if they're not active and they're eating a lot of starches that they serve in the schools, then they have a higher chance of getting this. If we can't teach them about how to reduce stress, I call it TPSA. Dr. Crawford and I talk about all the time, troubleshoot, problem solve, and adapt. If they don't understand how to do that, they're going to have a much more stressful life as they go forward. And I think stress is the difference in us and everybody else. I think everybody else has the same diet we have, probably exercise about the same that we have, but I don't think anybody else has the same level of stress that Black men have. So we need to start these young men learning about the prostate and how to maintain proper health of this prostate at a very early age, just like they learn about diabetes, just like they learn about obesity, just like they learn about liver and kidney and all of these other heart, lung health. They need to know about prostate health and then the issues that can come about with the prostate. So I'm trying to figure out a way to challenge my fraternities. Thank you for being on there, Brother Knox. Challenge the fraternities, challenge the Masonic societies, challenge the churches. There are just too many places. Challenge the barbers to have events. And I like the idea of a basketball tournament or even a bowling tournament or tennis tournament or something that we can get people together and then educate them, because education is going to be the key, but it has to start early with our young men so that when they get to be 45, they already know what's going on and they won't run from that word like Johnny and I did when they said cancer. Oh man, I mean, it was just a flood of emotions that went through me because I figured everybody I knew who had cancer had died. So I'm sitting there thinking, okay, I won't live 2 years. So then I started talking to my uncles and my brother, and they said, oh, no, 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 no. You can live another 30 years if you just, take care of yourself and follow the instructions. So, but we have to start early. And Brother Collins, I'm hoping to get in touch with you because you just said some great things, and I just need to figure out how to do them in Texas and in the South and in Pennsylvania and wherever else I go. I would like to know how to do it.
All right. On that note, thank you all so much, gentlemen. This has been a fantastic panel. And we heard about education and people not necessarily knowing where to go. Jerry's put in the chat our Fen Path resource where you can go. Oh, looks like we have one quick question. Yeah. How can a man get educated on prostate health, not just prostate disease? I just heard glucose and stretch. Okay, so I will have Dr. Keith Crawford answer that for you. And thanks for asking. Gentlemen, thank you so much for being here. We will connect you all. I love making connections. That is what we do at FEN, and look forward to hearing more. All right. Well, so turning our attention, thank you all so much for being a part of this fascinating conversation. All right. So turning our attention, I want to continue along these same lines with a presentation on managing survivorship. What have we learned? And I'm going to share a presentation and kind of walk you through a Fen and Dana-Farber collaboration. Here it is. Just do a slideshow view. Okay. Hopefully everyone can see the right screen. Let me know if not. I'm sure Jerry or Meredith. Okay. Okay, good. All right. So I want to thank the Dana-Farber team for inviting us to present an abstract for the poster session at the 2025 International Cancer Education Conference next month in Memphis, Tennessee. And we are so pleased to announce that our poster has been accepted. And I thought, what better way to talk about managing survivorship than to walk us through the actual poster and what we will be presenting as part of this collaboration. So I'm going to review the background, screening, and disparities at a very high level because we've addressed these topics previously throughout the summit. You can go back and view any of these episodes on fentv.com, including this session, and we will have resources and slides available as well. And our goal within this presentation today is to showcase the successful partnership between FEN and Dana-Farber. So in terms of background, you'll see that we tell men what we just heard. What is the prostate, right? This is where we're educating. What is the prostate? Where is it within the body? And what does it do? How do you know if you're at risk? Then it gets into screening guidelines, and it talks about NCCN, or National Comprehensive Cancer Network guidelines, which we all follow at FEN. And talks about recommended age at 45 for men of average risk and 40 for those at higher risk, such as those having a family member or family history, or African-American men especially. Then it goes into some of the barriers to screening that you've heard here today, right? We talk about limited access to preventative care. Others face challenges with language, inconsistent health information, lack of provider recommendations, which is why we develop those tools like FENPath. And as Johnny mentioned, discomfort with the perceived sexual nature of prostate cancer screening procedures and what that would mean for the future. And then we go into rates and disparities. And I'm not going to go too far into these, but also I'm just going to say, we see that Black men face the greatest burden. And in Boston, they're nearly twice as likely to be diagnosed and 3 times more likely to die from prostate cancer compared to white men. And this follows the trends that we're seeing around the country. When we go out and we screen, Dr. Crawford does an analysis and statistics around the country, and we do see a similar trend of men who are facing this burden. So it's not just Boston, we know it's nationwide. So I'm going to tell you a little bit about this partnership, which is so exciting to me because I've been here since the very beginning. In 2003, Dana-Farber Cancer Institute partnered with FEN to come together to pilot a community-based cancer education initiative. The partnership combines, as you heard today, a lot of us have treatment at Dana-Farber, one of the best cancer hospitals in the world. Dana-Farber's medical expertise, coupled with FEN's resources, our national reach, trusted community voice for culturally relevant education, outreach, and survivorship support. And in terms of programming, we offer monthly managing survivorship meetings and webinars in person and also at Dana-Farber Cancer Institute. We offer educational webinars, which are broadcast nationally on FEN TV, and they cover topics such as treatment updates, mental health, sexual health, PSA testing, from early detection through the monitoring phase, survivorship support and resources, and clinical trial updates. These monthly meetings take place at Dana-Farber in Boston, where patients and survivors often bring their spouses, which we heard today, a lot of that, for support, share dinner prior to the meeting. In addition to space and food, Dana-Farber provides medical experts, speakers, social workers, and oncologists. And FEN members also serve as ambassadors to spread awareness and promote early screening. So they come in and it helps us teach our own ambassadors about prostate cancer so that when they're in the field, they can feel confident going out in the community and telling others about it. And I want to tell you about the evaluation and impact of this program because it's really come far since it started in 2003. Since then, there have been 242 monthly managing survivorships meetings. The group has so many benefits, not only including just getting together and learning, but also fostering strong bonds. In fact, 20 people have attended regularly in person since 2021. It's pretty rare in today's virtual world. And it's kind of established a nice brotherhood. You can see the guys there at the bottom left corner in their FEN t-shirts. And it's just a really nice place for them to come. And from January through July 2025, we prepared this in August of 2025 this year. So between that time, FEN hosted 7 survivorship meetings, About 1,154 people registered online and 424 attended. The treatment options update session in July had the highest turnout. We had 204 participants. We received feedback from 300 respondents regarding these sessions, and here is what they're saying. 95% would recommend the managing survivorship sessions to others. 99% were satisfied with the content. 94% felt the pace was good. 87% felt the speakers were excellent. 95% would attend another session. 77% felt the audience Q&A was good. And I need to caveat that to say that sometimes we get so in depth with these topics that we run out of time. So there's never enough time. It's a good thing because we want people and encourage always people to ask questions. So you can see this trend line. We started out in 2021 with about 726 people. Then we moved up to 775. 2023, we're up to 862. But look at that jump in 2024. We see a 55% increase, which is incredible. But also in line with what we're hearing today, right? Men are hearing about prostate cancer later. They may be diagnosed later in life. There's all types of reasons that we could see this jump. We're also doing more in the community with our prostate cancer community rallies and church partnership program. So we're seeing growth. The message is getting out and it's working. In conclusion, we think this is a fantastic partnership and we're so proud to have it with Dana-Farber. It highlights how a hospital and a nonprofit organization team up to strengthen cancer education and awareness among let's face it, a historically marginalized group of people to improve health outcomes. And FEN's programming empowers participants and caregivers to make informed decisions, support one another, and spread awareness within their respective communities. And the model can be replicated to improve cancer awareness, education, early detection, and screening rates. And we're seeing it now, even as technology advances, authentic human connection with experts and survivors remains one of the most powerful drivers of trust and action. So there is an option to join online, but also you can come in person. And we are really proud of this relationship that we have with Dana-Farber. I am going to open it up for any questions that anyone may have about our managing survivorship meetings or any other remarks that anyone wants to make.
Yes, Tamika, we have one question.
Okay.
Is the support group open to everyone, even women?
Yes, good question. The support group is open to everyone, even women, and women actually and men are invited to be part of our survivorship and caregiver. We do have caregiver sessions. If you go on FEN TV, you'll see some of these couples. We know prostate cancer is a couples disease, and we heard it here today. So we want to make sure that we're educating caregivers, spouses, men, women, and their families about prostate cancer because it's not just a man cancer, it's a family cancer, and spouses and women are open to attend the meetings. And I will say these meetings are held the second Wednesday of each month in person at Dana-Farber. They're also online. If you want more information, we'll put the link to attend the meetings in the chat, but it's at rapcancer.org. And under managing survivorship meetings, you can see how you can be a part of these meetings. And with that, I would like to bring up our founder and president, Thomas A. Farrington, for a special awards ceremony and an introduction to one of our partners here today.
Thank you, Tamika. And thank you for all of those fine presentations with our survivors. I thought that was a great panel and great remarks that I'm sure many will learn from. So at this time, I am delighted to participate in one part of the program that I like best, and that's recognizing and thanking people for their support of FEN and our mission. And, Tamika spoke about the work that we're doing with Dana-Farber. And so I'm going to talk about that a little bit more in detail. And while I'm doing that, I am going to ask Magnolia Contreras to kind of join me on screen. So, hello, Magnolia.
Good afternoon, Tom.
Thank you for being with us and welcome. It's always a delight to see you. And so today I want to talk about the work that we've been doing with Dana-Farber now since 2003. You know, for Finn to have the success that we have had and continue to have with our programs across the country, I'm always reminded that we started right here in Boston. Boston, Massachusetts is our home, it's where we started. And we started with one partner. And that partner was the Dana-Farber Cancer Institute. In 2003, soon after we formed the organization, we began to outreach in the local area, and we were pleased to be invited to come to Dana-Farber to host meetings. And Athene Wilson, I'm not sure Athene is with us today, but she was working with Dana-Farber at the time and invited us to hold our meetings there. So since 2003, we have been sequestered down at the Dana-Farber Cancer Institute. And that relationship has been the foundation that has allowed us to develop our program and to spread our program throughout Massachusetts and throughout the country. And that's that I don't know what we would have done without such a supportive partnership and relationship. You know, Dana-Farber is one of the leading cancer institutions in the world. I think we're ranked number 3 in the USA as leading institution. I happen to serve as a member of the board of trustees at Dana-Farber, and I have for many, many years. And Magnolia is the vice president of community health. And Magnolia has held that position, I think, now for 5 or 6 years. Is that right, Magnolia?
Right, yes.
Okay. And so I work very closely with Magnolia, and she supports the work that Finn does. So today, we have a number of awards that we're presenting. My first award goes to the Dana-Farber Cancer Institute, and this is the award. Now, I want to present this to you, Magnolia. And the award says, it's a partnership award presented to Dana-Farber Cancer Institute, Magnolia Contreras, Vice President for Community Health, in recognition and appreciation for your partnership and support of Finn's educational and community outreach program since 2003. Think about that. That's 22 years. It's presented at Finn's 21st Annual Summit on today, and I am so pleased to award you this token of our appreciation, Magnolia. So Magnolia, I will stop there and have you say a few words, so you can come on.
Thank you so much. This is such a wonderful, wonderful recognition. On behalf of Dana-Farber, I am pleased to accept this award. And Tom, it has been an absolute easy and wonderful pleasure to support the work of Fenn. And indeed, a lot of the work that you are doing today and the work that has evolved, I always, even when it may not be true, know that Dana-Farber played an important role in the adult and grown-up organization that you now are at 22 years old. I can say that I've been a part of it directly and indirectly, and now as vice president in the last 18 years, and we've seen and gone through a lot. Indeed, we want to give credit to Athene Wilson Glover, who helped in the beginning to forge and bridge the relationship. Mark Kennedy, who was instrumental in running our prostate cancer and education screening program at the time, where that too was a shared screening program. Ann Levine, at that time as well, who was the vice president at that time and has always been a vocal supporter and leader of FEN. And of course, absolutely, we could do nothing if it weren't with the leadership of Dr. Jacques Carter, who really is the right doctor for the right program at the right time, who helped us talk to community health centers about the latest information about cancer and taught many of them, and continues to do that, but at that time taught many of them how to talk to Black men about prostate cancer, and taught doctors how to understand the complicated and confusing ways in which the reports and the screening guidelines were. I cannot thank Dr. Carter enough, and I know he continues to play a vital role, but during those difficult years, he really was the glue that kept us together. I also should thank the community programs trustees, Tom. They have always looked to your program as one in which they feel that kinship with you and a lot of pride in terms of its evolution over the last 22 years. And I'm so pleased that we continue to support it through the work of our colleague in my office, Samantha, who also plays an important role to make sure that our relationship still continues. And we hope that with the plan to start a screening program, that it will only flourish further, and it will continue to evolve and move forward together so that we can try to bend the curve around prostate and its impact in our men and in the men in our communities. So I cannot thank you enough for working with Dana-Farber, and we look forward to many more years. Thank you.
Magnolia, thank you, and thank all of Dana-Farber for that support that we continue to receive. And you know, I will always remember that former President Dr. Ed Benz and former Vice President of Community Health Ann Levine traveled to DC for one of our second summit in Washington, DC, and they joined us there for the summit. So Dana-Farber has been with us hand in hand. And you mentioned screening. We had a strong screening program that was led by Dr. Carter and Mark Kennedy many years ago. Some of the guidelines changed that, but I know you and I are now talking about reviving that and revving that up again. So we're looking forward to not only replicating, but expanding greatly what we did in past years. So Magnolia, thank you so much again for all of your support. Thank all of our friends at Dana-Farber, and we look forward to moving forward together. Thank you.
Thank you so much. Thank you very much.
So now we will continue our awards program. So I'm going to ask Meredith to bring up my next display of awardees. And these are such special people, you know, and one of the reasons that they're such special, you may see Warren Farrington there in the center, who happens to be my wife. And this is when we talk about the work that we do as survivors, as a leading organization here in Massachusetts and around the country, we're able to do that with the support and help of many. And there's no support more vital and more impactful than that of our loved ones. And so we have created a President's Award this year, recognizing some of the loved ones who have made a major difference in what we're doing and continue to do so. You know, I was listening to Tony Knox talk about his wife and the experience that he had when he was diagnosed and talking with the doctors. And I had to smile because that goes for my wife as well. We often have words. You know, I consider myself a pretty aggressive guy. And but whenever I go see the doctor and we walk out, she will always tell me I didn't do enough. You didn't press hard enough. You didn't do enough. I said, well, hey, I don't know what else we could do. I think we hit it as hard as we could do it. And so she would invariably come up with some angle that I haven't thought about that we should approach. And you know, I've appreciated that over the 25 years that I've been a survivor. Not only have I appreciated that on a personal basis, but with Finn, when we started Finn, she's been by my side, helping me with the different approaches that have succeeded in making us the organization that we are today. And so, you know, when we
Hi,
talked
Shirley.
about this award, I said, Juarez, you know, you should get one of these awards. And she said, no, I don't believe I deserve a award. I am with you as your wife and your partner. I said, well, that means you deserve 2 awards, but we're going to give you this award. So the first award I have to make for the President's Award, I want to recognize my wife of 58 years, Juarez Farrington. So give her a kind of a virtual round of applause.
Hello,
And
everybody. I am a caregiver of a survivor of 25 years. It has been great. And I thank him for the award. And I told him that I really didn't need anything. I'm just thrilled that he is able to keep the organization going. And I just want to thank him. And I want a special thank you to my friends and all the support that I get from the community, my sorority, my church, everybody. Because every time I see someone, they said, okay, Juarez, how much is it going to cost you? But it doesn't. I just want them to support us with golf tournaments, you know, get the word out for Finn. And I have a special thank you from my family because they have been there. It's a family affair. I have 2 sons, Chris, Trevor, and then of course my daughter Tamika is here, and then my granddaughters, my in-laws, my daughter-in-laws, and so they are so protective, and we're all, you know, rally around Tom for all of his needs. And I just have to share something that every time they come over, I ask Aaron, who is Chris's son, and Aaron was like 5 or 6 years old, to come with me to the office because I have something to do. And I said, okay, Aaron, if you do bags for me, I'll give you 25 cents for every bag. Do you know, Aaron came in here and did 100 bags in an hour, and I ended up having to give him $25. And so then the other grandson came in on Saturday. He says, okay, Grandma, I did the same thing. Are you going to pay me? And now we have London, who is 6, and she wants to come over here before she goes to the park because everybody knows there's something over here. And they love to come over and make bags and talk to Grandpa and be here. So I am just thankful for that. And I want to thank all of the support that we have.
thank you. Thank you so much. Thank you. And the next person I would like to recognize is Clarice Green. And Clarice,
Yes.
Clarice is here. Clarice is in the DC, Maryland area. And Clarice has worked with us. I think she's been to almost every summit that we've held in DC. And I think she goes to every health fair, every event with a church or whatever in the Maryland, DC area. Every picture that I see of our events, she's there. And she's there with the smile that you see. So Clarice, thank you so very much. We love you. We certainly appreciate all of the great work that you do, all of the support that you provide to us. Thank you.
And thank you too. And I really enjoyed from the bottom of my heart.
Well,
Thank you.
thank you. And we appreciate it from the bottom of our heart because you're helping to educate and save lives of many that see you at these events. And I see you handing out the bags. So thank you again.
All right.
The next person I would like to present the President's Award to is Shirley Rose Robinson.
You
And,
kidding me?
Shirley is a person that's been with us since 2003. And that's when we started FAIR. There was a young man that you will see not too far from here. And I call him young because he's my age bracket, and I like to think of us as still young. But he's been with me since day one of FAN, and Shirley has been right there by his side and by our side, making a difference, doing the same types of things, meeting with people. All of the meetings that we've had at Dana-Farber, Shirley, I don't think I ever missed seeing her at a meeting. So if she missed any, it was very few. And she was there, and again, she was out in the field helping spread the information. She was at the churches with us. And so, Shirley, thank you so very much for all the work that you've done. And I am so pleased to recognize you with the President's Award today.
Thank you, Mr. Farrington, and thank you, Finn. I am just so humble to receive this, but it's been a pleasure. I enjoyed being there at every moment with my husband and with the Finn family. And thank you again. God bless.
Thank you. Thank you. The next person that I'd like to recognize is with the award is Karen Salmon. Now, Karen is likewise has been with us and her husband, Rich Salmon. And I love these ladies. I love these ladies because they are so committed and they are willing to work so hard, and they do it with a smile. And I only have to ask a half time for support. I don't have to finish my sentence when I want some support. And that's especially true with Karen. I can look at Karen like I need some help. She knows what I need, and she's always there. So, Karen, I am so pleased to award you this President's Award today. Thank you for your support.
You are very welcome, Tom. I am glad that I can be there to help you and support the Fenn family. You all has always felt like family since we've been coming to the meetings, and we appreciate you. So thank you.
Thank you. Thank you. And the last person that I'd like to recognize, but certainly not the least, is someone that I've been so impressed with for just a few years because she came on board with our efforts in Jackson, Mississippi, with her husband, Jerry Knight. And so I'd like to recognize Connie Knight as with the President's Award. And Connie, like the other ladies, every time I see a picture coming out of Mississippi, Connie's in that picture. And when I visit Mississippi and with some of the events, she's always there and she's working. She's not there taking pictures, opposing. She's taking pictures of others and she's working hard. So Connie, thank you so much. And I'm so pleased to award you the President's Award.
Thank you so much, Tom. It has been an honor and a pleasure to be a part of FIN and all that it represents as far as helping men to survive this prostate cancer disease. I am just very honored to be a part of the organization, and thank you. And I thank my husband for his courage and inspiration in all of our efforts here in Mississippi. Thanks again.
Thank you so much. Now, these ladies represent a few of those that are committed to what we're doing. And this is an award that I think this is the first year we presented it, but we're going to make this a continuing program. We will present this award each year. And I know that there are others that are working hard, there are others who are committed to this cause, because as we've heard from the stories of the survivors, they're committed to their families. They're committed to their husband, prostate cancer journey. And they're willing to give up their time and their energy to support that. We have a lot of work to do. And with the support of our loved ones, we can continue to make significant progress. And so, again, I want to thank each of you for your support over the years and for your continued support. I want to thank those who we didn't recognize today and let you know I look forward to recognizing you next year and the years to come. So thank you very much. Now, the Tamika is the moderator, and Tamika, my next role, I guess, is the Lifetime Legacy Awards, and when this is quite a handsome group of men that I see in front of me, and what I want to say about these men and these warriors and these leaders is that they're committed to the fight against prostate cancer. They have really committed to it. They have not only committed to do what's necessary to support them and their personal needs, they are really committed to supporting the needs of others, other men, other families. And these awards that we're presenting today are to some of the leaders that's worked with FAN for many, many years. And that's the reason we're calling this our Lifetime Legacy Awards. Because everybody here, as I look at these pictures, each one takes me back to very specific efforts, very specific times in our journey, in our efforts, where I can see them just making tremendous contributions. And I'll talk about some of those as I introduce each one of these awardees. So now we have a picture of the award. Is that right, Meredith? Can we see that? Everybody see that, please? So this is our Lifetime Legacy Award. And this one is to Eunice Robbie Robinson. But they all are the same award. And it reads, in appreciation for your many years of leadership and support of FIN's efforts to eliminate the prostate cancer African American disparity. Presented at FIN's 21st Annual Summit, Wednesday, September 24th, 2025. And so it gives me great pleasure to make this award. And I'm going to make the first award to Eunice Robbie Robinson. You know, I never called him Eunice, and I didn't know probably for 10 years that his name wasn't just Robbie.
Okay.
But it is Eunice Robbie Robinson. And so, Robbie, I would love for you to step up. There you are.
There you go.
And let me say a few words about this young man. And as I said, we all have these gray goatees, but age, part of the age is in the mind. So we're still young men. And Robbie has been with Finn since the very, very beginning. He and I have known each other for many years. We went to church together. And when I was diagnosed with prostate cancer, I wrote a book. Robbie got my book when he was diagnosed. And we talked about that. And so when Finn was founded in 2003, Robbie was kind of right there. He was right there with me in our very first meeting at Dana-Farber. And he's been with me and Finn on just about all of our journeys. And I am so honored to recognize this man for the work that he's done over those years. Robbie, thank you so much. You really deserve this and much more, but you've impacted a lot of lives.
Thank you. Thank you.
So we look forward to moving this forward together. So thank you again, Robbie.
Thank you.
The next person that I would like to recognize would be Dr. Artie Shelton. And Dr. Shelton, if you would step forward. Okay. All righty. So, Dr. Shelton, put your audio on. There we go. Okay. All right. And I say something, Dr. Shelton. Say hello.
Hello, can you hear me,
Yeah,
Tom?
we got you. So, Dr. Shelton, I don't know of anybody who works harder at educational outreach than Dr. Shelton. Dr. Shelton is in the DC, Maryland area, and he's one of our ambassadors. He has, I think, at least 2 events a week, because as I look at all of the ambassador reports, I see that we get more information from Dr. Shelton, and that not only do we get information about the efforts that he's done, we get the information about the ones that the next 2 that he's planning for the next week. And so Dr. Shelton has been with us. He used to open up all of our summits in Washington, D.C. And he would always meet us at the Capitol building, or the building where we were hosting our summit program. And I wanted to beat him there, just be there before him. And I never could do it. So I think the only way I can beat Dr. Shelton to a summit event is virtual. So he is really, really a major asset for FAN. And Dr. Shelton, it gives me great pleasure to present you with this Lifetime Legacy Award.
Tom Farrington, Mr. Farrington, thank you so much. I really appreciate the honor. And as I consider you my mentor and my friend, in 2003, when I was diagnosed with prostate cancer, as many of the survivors mentioned, I was scared, even as a physician. And believe me, it was your book, Battling the Killer Within, that really, my doctor could not answer a lot of the questions. And that's how I found you and I met you. And I attended all your conferences because you taught me so much, and really helped me as a survivor. So I'm a 22-year survivor, and I really appreciate everything you, Finn, Juarez, and the organization does for everyone.
Well, thank you again, and I'm glad that we were able to help you, but I want you to know that you've helped many, many more. So again, thank you, and I'm so honored to present you with this award.
Thank you, sir.
The next person that I would like to present an award to is Dr. Jacques Carter. And Dr. Carter, when Magnolia spoke about the work at Dana-Farber, Dr. Carter ran the screening program there for years. So we worked together with that screening program. Dr. Carter has been a member of our board at FIN and a great advisor, a personal doctor for many of the men that come to our events. I would always see him after our events at Dana-Farber. He would be surrounded by men looking for personal care and his personal words about their care. And he never stepped away. He was always there. He has been with us since the very beginning. And Dr. Carter, I am so honored to present you with this Lifetime Legacy Award.
Thank you, Tom. I'm really thrilled with the award, and it's a big surprise, actually. I'm happy to be here with Dr. Shelton and others, and I feel very, very, very humble to get the award. I often tell people that I first came to the FIN meeting in Dana when I became the medical director for the prostate cancer screening and education program at Dana-Farber, just to sort of see what was going on. And for some reason, after 2 or 3 meetings, I was part of the program. And it's been since that time, I've still been doing it. So that points to the fact that you know how to bring people together. And I'm glad that I sort of wandered into that conference room that day for that FIN meeting and have been involved with FIN ever since.
Well, thank you so much. And, we're not going to let you wander out. So we're going to keep you. And we appreciate all that you have done and all that you're still doing. So again, I'm honored to present this award.
Thank you very much.
The next person that I would like to present the award to is Mr. Jerry Womack. And Jerry is another fan ambassador who's in Charlotte, but he hails out of Boston and was with us here in Boston. He was at our very first summit many years ago, back in 2005. And he's been with us since, you know, as Dr. Carter points out, once we get somebody in that circle, we don't let them go lightly because we do recognize talents. And so Jerry has a great talent to work with men, and he's just made a difference with our mission. So Jerry, I am so honored and thrilled to present you with the Lifetime Legacy Award today.
Thank you, Tom. It's been a great pleasure to be a part of FIN. I jumped in 2004 when I was diagnosed, and you and FIN have been very helpful to me. While I was in in Boston, and then moving to Charlotte, even before asking to be ambassador, I just felt that because of the help that Finn and you and so many of the other survivors provided for me, that it was my duty and responsibility to continue to share the message of early detection and try to save men's lives. And so I'm proud to be a part of this team and to work with you and all of the people at Finn and trying to decrease this disparity one man at a time and to help to be able to save lives of our Black men. Thank you for the recognition.
And thank you again. Thank you for all that you do. Now, the next award I'd like to present is to A.J. Merriweather. And A.J. is a fan ambassador in Jacksonville, Florida. And A.J. is somebody that we met and we were doing outreach there.
did it, ain't nothing.
And AJ, I found, very, very committed to the fight against prostate cancer. And he's been a great asset for us there. We've done a lot in that area on the back of AJ, and he's been a great leader. So AJ, I am proud, pleased, and honored to present you with this Lifetime Legacy Award today.
Hey, Tom, I'd like to thank, can you hear me?
I can hear you, but we can't see you.
Yeah, my video is not working.
Okay, but we listen.
Anyway, Tom, thank you for that honor. I'm very, very surprised because prostate cancer is something that no one wanted to be a part of in the beginning. And by meeting you back in 2013, I believe, with Dr. Odetner at University of Florida campus, that was the biggest thing that I could say that changed my life. And that was meeting you and the journey that Finn was just kicking up or getting started. It's been wonderful, even with the Daddy Boy play. You know, to the gentleman that's on the panel, I'm honored to be a part of this legacy because, Tom, I'm just a regular old street guy that just love to go out and just talk in the street and share my story. And to the guys that's coming up behind us, Finn has been a wonderful tool from the start. And to watch it grow, Tom, over all these years, I've been honored and blessed to be a part of the Finn Network. And thank you, and God bless you, sir.
Well, thank you. Thank you. And God bless you. I know that AJ has been challenged like many of us with some health issues, and it's so great to see him up and back online. And, you know, I always worry about AJ when he has his challenges, you know, because AJ doesn't like to stop. And I'm always afraid that AJ blindly just works through any of those personal health challenges. And I always find myself trying to figure out how do we slow AJ down so he can take care of himself. So AJ, it is so great to see you up and doing well. And again, I'm just pleased to present you with this well-deserved award.
Thank you, sir.
So thank you.
Thank Finn.
I think that Yes. And we have now, I'd like to present an award to Mr. Raymond Fuller. Now, Ray Fuller is also a Boston native. Well, I shouldn't say he's a Boston native, but we met him here in Boston. We began our relationship in Boston. He's literally from Savannah, Georgia area, where he is now. And so Ray joined Finn while here in Boston, worked with us, brought his church and other churches in as part of the Finn network here in Boston, and has been a great supporter. And so when he moved to Savannah, he said, Tom, well, you know, I'm going to Savannah. I said, well, good. That means we are spreading our wings to Savannah with you being there. And so he has been very active with us in Savannah for the last few years. But Ray has done a great job. So Ray, it gives me great pleasure to present you with this Lifetime Legacy Award.
Thank you, Tom. Can you hear me?
Yes, we can.
Yes. Thank you so much for this Lifetime Achievement Award. I really appreciate it. I can remember the day that you brought me into the Finn's family. And then you visit me at the State House when I was singing for the Martin Luther King breakfast there. Little did I know then that I would become even a more active person with Finn and become a part of the Finn family. You all have been so gracious and so supportive of me, and I really appreciate that. So with that being said, I would like to say just thank you for honoring me with this award. It means so much to me.
Thank you. And you mean so much to us for all the work that you've done. Now, I'm going to let you all in on a little secret. You know, Deacon Ray would always close out our sessions at the Washington Convention Center with the Congressional Black Caucus with the song "I'm a Living Testimony," and I know that that came up earlier with Tamika's panel. And before this session today, I gave Ray a call, and I said, Ray, you know, I'd love to close out today with your saying, I'm a living testimony. Do you think you can do it? And so Ray said, hey, let me go tune up. So I assume Ray's been tuning up, but we're going to be treated today as we close this session with I'm a living testimony. And so people can understand the beautiful voice. Not only is he committed to work, but he's committed to inspire through song. So Ray, we're going to bring you back. So again.
Okay, thank you.
All right. So thank you. We're going to bring you back. All righty. So the next person I'd like to recognize is Dr. Matthew Kennard. Now, Matthew is not with us because I heard that he had an appointment today, and so Dr. Shelton, can you come on as I say a few words about Dr. Kennard? Okay.
Yes, sir.
All right. So Dr. Matthew Kennard was also one of our leading outreach coordinators in the Washington, D.C. area. He was at, I think it was Howard or UDC. And at our summits, Matthew, Dr. Kennard would always be there to participate, helping outreach, helping get the audience and participating in those sessions. So, you know, we really do appreciate what he did over all of those years. And I am pleased to present him with a Lifetime Legacy Award. So Dr. Shelton, you have a couple of words you can say about Dr. Kennard?
Yes, sir. Dr. Kennard, as Mr. Farrington said, is a professor and scientist, and he was really very, very essential during our whenever we had the annual, African American Prostate Cancer Disparity. As Tom said, he would bring students with him. He would bring young, students with him to learn about some of the health issues that we face as, African Americans about prostate cancer. And so, like I said, he was really, very important to us for getting the message out and continue to get the message out to this, even to this date. And he did send a message back, Tom, that he really regret not being able to be on, but he did have an appointment with a physician, and so that he had to make that appointment. But I'm sure he'll be able to see the video and hear your message, to congratulate him.
Thank you. Thank you. Yeah, Matt has been quite a supporter and quite an asset, helping us with all of the work that we've done. So thank you so much, Dr. Shelton, for those words on his behalf. Now I'd like to recognize Mr. Richard Salmon, and Mr. Salmon also had another commitment today, but Richard is a person that, in fact, I don't know, Karen is probably not up front now, but that is Karen Salmon's husband. And as part of what we did with our work at Dana-Farber, with to reach out with our programs to other centers, to other cancer centers. One was in Worcester, Massachusetts, which is a few miles, I would say about 20, 25 miles outside of Boston. And Rich Salmon coordinated that whole activity in that community. And so every once a month, when we held our meetings at Dana-Farber, he would bring a group of survivors and their families together at the cancer center in Worcester. And so he did that for a number of years. He coordinated that and was very much involved in our community outreach and that program specifically, which made a great difference in the lives of so many men in that area. So I wanted to thank Rich for all of his support over the years, and he continued to support us. And with the awarding of this Lifetime Legacy Award. So thank you, Rich Salmon. Now, I think that those are the Lifetime Legacy Awards. And again, I would just like to say to all of you, we love you and we appreciate what you have done in helping us with our success to help others over so many years. Thank you. Now, one of the areas that we like to do each year is to, if we've lost one of our warriors, one of our heroes in battle, we certainly want to recognize that person. And this year, we have a special individual as part of our in memoriam service. And that's our Finn ambassador who's in Houston, Texas, Dr. Dwayne Charleston. And Meredith, could you bring up that information? Okay.
When we think of metastatic cancer, the majority of people, if not all.
Can we back up on that? I'm sorry. Meredith, can you put the slide up again? Okay. This is in memoriam to Dwayne Charleston. And as you can see, Dwayne was a relatively young man. He was born in Texas, on the campus of Prairie View A&M University. He was elected the first Black Justice of Peace in his home area of Texas, which is outside of Houston. He was diagnosed in 2009 at a young age of 48 years with prostate cancer, which was metastatic. And he was a powerful advocate for men's health. And he worked very hard with us in that area. We made great strides in his area under his leadership. And we lost Dwayne this year. And we did a salute to him at one of our programs at Dana-Farber in June with his passing. And it was done by our Dr. Keith Crawford, who knew Dwayne. And so we're going to replay that service, that salute done by Dr. Crawford. Thank you.
When we think of metastatic cancer, the majority of people, if not all of us, thinks that your life is over. Because even when you looked at the messaging that was coming out of the White House, it was pray for me as if there was no hope or little hope. The reason why I put this gentleman up is this is Dwayne Charleston. He's from Texas. And he passed last week. He passed last week, but fought every day to live. He had prostate cancer. He was diagnosed with prostate cancer. And I always say be very careful about statistics, because the statistics say that if you're detected late, advanced disease that's moved throughout the body, that your life expectancy for 5 years is around 30%. Your life expectancy for 10 years is about 18%. But we really don't have an example of a person or what can happen after 10 years. And Dwayne Charleston is a person who I will explain how he lived 16 years with advanced stage prostate cancer. A little bit of his background. Now, he's from Texas. I'm from Texas. We pledge the same fraternity, Alpha Phi Alpha. He was born on the campus where I went to college. And he was also a Finn ambassador for the state of Texas. And the state is big, and Dwayne Charleston covered the state every single solitary day. In his life, in his journey, he was diagnosed in 2009. 2009 with advanced disease in his 40s. So look at what he shows you. One, he had to be in his 40s to be diagnosed. He wasn't screened. And when they caught it, it was in advanced stage, in a metastatic state. So, but he didn't give up working with his the academic center in Houston, MD Anderson. He fought every day, and I mean fought. He would get up every day and work out, hour and a half lifting weights. He would run bleachers, wind sprints with 35-pound weight sacks on his back because he wanted to live. But he just didn't live for himself. He lived to spread the message why it's important. Men's health is so important. So he wrote his memoirs, and then we came in contact with each other because I'm an alpha, he's an alpha, and he was in need of something other than the treatment that they were providing. So Finn, helped him get into a clinical trial. and helped him to get in 2 clinical trials that allowed him to move forward for another 3 or 4 years. Now, 3 or 4 years where he can fight. Now, a week before he died, he called me up on the phone and said, Keith, I got a guy who has prostate cancer. He needs help. That's a person that is extremely strong-willed. And even on his deathbed, he was trying to help people. Amen. So we're dedicating this session to him. Amen.
Thank you, Dr. Crawford. That was a moving tribute. And I can say that Dwayne was really, really committed. He's based in Houston area, but he worked with us. We did a program at the Cotton Bowl a few years ago, which is in Dallas. And it was Dwayne who coordinated that effort with Prairie View. So we will miss Dwayne, but while he was here, he did make an impact. So I would think that we are a few minutes ahead of schedule, which is great. And because the next thing I think on our agenda really is to kind of wrap up not only this session, but I'd like to talk about the 4 sessions of our 21st annual summit. And so I'm going to take a couple of minutes to do that. And then we're going to move forward. But I want you to hang around because you're going to be treated by Deacon Ray Fuller and with his singing. So Meredith, could you bring that piece up for me? The first session that we did was around early detection screening. And that's an area that we have been heavily involved in for so many years. And we committed to this because it is so vital, so very vital to saving lives and addressing the disparity. I think we've talked about the statistics. If you screen early and the difference, your lifetime expectancy difference, as opposed to if you screen late. And this is certainly so very true for Black men. And we're not getting the information out into the hands of the public. And the guidelines are really not appropriate for our use. So this is an area that we address. And I might say it is an area that we will continue to focus a lot of our efforts on. We have some plans that we've been evolving as we speak even today that we're hoping to kick off early in the coming months. So stay tuned. This is still an area that we're very much committed to, and it's an area where we will spend a lot of resources because it is so important. And our second session, we looked at faith and partnerships in action. Today we talked about through our survival stories the need for work at the grassroots level. We do that, and we do it a lot through our community rally, and there's much to be done. We have made tremendous progress there, I think, from the days that we started here, just in Boston, to now having a nationwide effort with resources, not just an effort, but we have resources and assets in cities and locations all around this country. We're going to continue that effort. We're going to strengthen and expand on that effort. Again, that is so very important to addressing the disparity. And our mission is to eliminate this disparity. The third session was increasing participation in clinical trials. There are a lot of trials, a lot of new therapies that are being developed. From the time that I was diagnosed till the day, from the time that I was diagnosed in 2000 until today, 2025, has been a whole sea change of treatment opportunities and therapies for prostate cancer. But as we saw from one of our presentations in this session, as Black men, we're not participating in these trials, so we still don't know the full impact of some of these new therapies on us. One of the things that we do know is some of the real world evidence and data collected from patients and survivors once these therapies are approved show that in many cases we do better than other men. Well, if we had a little bit more information, more involved in these trials, we just are not sure what impact that it will have on eliminating the disparity. So our commitment here is to make sure we get more men in these trials to help them on a personal basis, but also to understand how we can help all of Black men face prostate cancer and live longer. So again, another strong area of commitment for us. And then we just heard today about the impact of prostate cancer on young men. It's not just an old man disease. And I was so pleased to see some of the things that are being done. And as we talked about them, I had some more ideas. So we will be looking at doing some new things around this whole area. But we need to continue to work that angle, get that message out, because we're diagnosed at a younger age. We have to educate at a younger age and be prepared to face and beat this disease. So I feel very good about the sessions that we had this year. I'm excited with the information that we have out there. Now, we have, some people come to these live sessions, but this is the beginning of this summit because we collect this information, we record it, and we promote it heavily. So this summit began during September. It runs through the end of December as we promote each one of these sessions via social media to get the word out on a much broader basis. Last year, we reached over 1.5 million people with this information. We would make those resources available, spend those funds to reach people around the country this year, and we hope to reach 2 million people with the messages that came out of these 4 sessions. So again, I want to thank all of the participants for being with us, participating in these sessions. And we will continue our efforts in the fight against prostate cancer. The summit is a big part of our outreach, but we have other ways of reaching you, and we want to continue to engage you to engage with us in all of our initiatives. Now, we just launched a new website right before we began the summit. You can go to rapcancer.org, R-A-P cancer, that's for Rally Against Prostate Cancer. We are really committed to being the best at this. We think we are, and we will continue to make the investment of time and fund to being the best, to reaching as many people as we can, to save as many lives as we can. And so we look for your support in these efforts. Now, we have a survey that we're going to put up, and I want you all to participate in this survey. And as you are doing this survey, what we're going to do is we're going to be treated by Deacon Ray Fuller, and I'm a living testimony. So, Ray, are you all tuned up and ready to rock? Can we bring Ray on? And one of the things I like to do, you know, is and as Ray comes forward, is I am so proud of the work that was done today by our moderator, Tamika Miller. Now, Tamika was a Farrington before she was a Miller. And so to have your daughter be able to contribute to our work, the work of her mother and me, is so gratifying. And she did a wonderful, wonderful job. So give her a round of virtual applause. And I might also say that Tamika was with us for our very first summit in DC and helping us put that on. So this is nothing new for her because she's been with us since the beginning. And she was with me when I was diagnosed with prostate cancer, as we used to have the discussions about my actions. And I really benefited from her love and support over all of those years. So Tamika, thank you so much for your great work today. So I think
Mr. Fuller is on.
Am I on? Can you hear me?
yes,
Yes.
we can hear you. We can hear you. Now we're going to be
Okay.
treated by Deacon Raymond Fuller. Yes, sir.
Thank you so much, Tom. But before I do anything, I'd like to just say a few words of prayer, if I may. Father God, I thank you for this moment and this time in life. I would like to thank you for what you're doing for Finn. I consider them as my family, God. And now, Lord, before I say thank you for anything, I'd like to say thank you for everything. Thank you for waking us up this morning and starting us on our way. Thank you for your grace and mercy. And now, Lord, hide me behind the shadows of your cross, that I may be able to minister to my family on Finn Network, that something in the song may touch someone, that they may say, thank you so much. In Jesus Christ's name I pray. Amen. I'm a living testimony. I could have been dead and gone, but Lord, you let me live on. I'm a living testimony. And I thank the Lord I'm still alive. Oh, I'm a living testimony. I could have been dead and gone, but Lord, you let me live on. I'm a living testimony. And I thank the Lord I'm still alive. I've seen miracles after miracles perform in my life. You keep having mercy on me. I don't deserve to be alive. When I faced dangers I couldn't see, Lord, you kept your angels camped around me. And I just want to say thank you, Lord, I'm still alive.
Oh, I'm a living testimony. Yes, I am. I could have been dead and gone, but Lord, you let me live on. I'm a living testimony. And I thank the Lord I'm still alive. Thank you for being alive. I thank you for this life of mine. Thank you for waking us up this morning. I thank you, Lord. Thank you, Lord. I'm still alive. God bless you all.
Thank you. Thank you so much, Deacon Fuller. And I want to thank everyone again for being a part of this. Mr. Barney Morris, thank you so much for kicking us off. And again, for everyone who participated. We wish you well and we wish you blessings. Thank you. And this ends our 21st annual African American Prostate Cancer Disparity Summit.